in a disease called glaucoma. I'm also a professor of ophthalmology at UCL, where I do a lot of research into eye conditions. My NHS practice is at Moorfields Eye Hospital, and my private practice is there and also at Clinica London on Harley Street. I got really excited by ophthalmology since I was a medical student. It combines the medical care and that need to make a clinical diagnosis based on examining a patient with actually being able to do something about it, and through laser and surgery, and it was always an innovative specialty. So for those reasons, I've been interested in ophthalmology right from the early stages. Ultimately, I wanted to go to medical school because I like people. And while some of my skills could have been used in other jobs, they seem to be more office-based or small team-based. Yet, as a doctor, you are constantly meeting new people through your patients. So that's what drove me to do it. I did the theory part of medicine at the University of Cambridge, and then went to London to the big, busy teaching hospitals there at UCL for the clinical part of my medical school.
As a glaucoma ophthalmologist, what training or fellowships did you do to get to where you are now?
So I've done most of my training at Moorfields Eye Hospital, which is one of the biggest it's one of the biggest eye hospitals in the Western Hemisphere, very famous for its training. So I'm very lucky to have done most of my training there, including fellowship in glaucoma training. This has been supplemented by a fellowship at Harvard Medical School for a period, and really we're constantly in training. And one thing I'm proud of is how engaged I am in the global community of glaucoma practitioners, staying up to date and learning from each other. So recently I was very proud to have been voted in the top 10 glaucoma specialists globally by our peers. And I think this is because I'm always trying to think of better ways we can manage patients, and challenging old ways of doing things which may not be the best, looking for the best evidence, and ultimately pushing towards a personalised approach of care. Studies can tell us what's best to do on average. So if all patients were the same, we'd know what's best to do. But actually, we can now understand what individual treatments would work best for each patient. My research really aims to better understand what causes glaucoma, be those genetic factors or factors in people's lifestyle, and really drilling into that and understanding that really helps me treat each patient as an individual, because everyone's different. People have different lifestyles, people are on different medications for their blood pressure or diabetes and so on. And we're learning more and more how these things influence the risk of glaucoma and risk of blindness from glaucoma. So understanding that from the research aim really helps me look after my patients. The other theme really, my research is really driving towards personalised care. So rather than treating everybody the same, starting off with the same drop or doing the same laser, my research aims to understand, well, can you work out which treatment will work best when given as a first-off treatment to patients, so that it's less trial and error and it's a better experience for the patient, and also more effective preventing risk of vision loss. From seeing glaucoma patients, the thing I enjoy most is how much we can do for them. For some other conditions, there isn't really that much you can do. Whereas with glaucoma, such an exciting field, there's new medications coming out, new forms of laser, and lots of new surgical techniques which are getting safer and safer. And so I like the fact that we have all of these available and that they're effective if the right procedure or treatment approach is chosen for each patient. I'm passionate about music. I enjoy listening to music, playing music when I can on the piano, and I used to compose. I don't have so much time for that now. But really music, no matter how stressful things get, I can listen to a piece of music or play a piece of music and everything feels fine. I'm at a quite basic level of French, and I actually speak a little bit of Arabic and understand it quite well. My parents are both Lebanese, and while they didn't ensure we learnt to speak Arabic, we could certainly understand it when they were talking to each other when my sister and I were growing up. As for French, my wife is French, and I can become a French citizen if I can pass French at a B1 level, which I'll know in about a month's time if I can. So if you're concerned about glaucoma, maybe you've been told you're at risk of glaucoma or have a family member with glaucoma, or maybe you would like a second opinion on your glaucoma that's already being cared for, then please visit our website, Clinica London, for more information and on how to book an appointment at our clinic on Harley Street in London. To book an appointment, please visit our website, clinicalondon.co.uk.